Pulmonary tuberculosis, TB, is a contagious bacterial infection that involves the lungs, but may spread to other organs. Tuberculosis symptoms. The primary stage of TB usually doesn't cause symptoms. When symptoms of pulmonary TB occur, they may include cough, usually cough up mucus, coughing up blood, excessive sweating, especially at night, fatigue, fever, unintentional weight loss. Other symptoms that may occur with this disease: breathing difficulty, chest pain, wheezing. Tuberculosis treatment. The goal of treatment is to cure the infection with drugs that fight the TB bacteria. Treatment of active pulmonary TB will always involve a combination of many drugs, usually 4 drugs. All of the drugs are continued until lab tests show which medicines work best. The most commonly used drugs include isoniazid, rifampin, pyrazinamide, femtol. Other drugs that may be used to treat TB include amikacin, ethambutol, moxifloxacin, para-aminosalicylic acid, streptomycin. You may need to take many different pills at different times of the day for 6 months or longer. It is very important that you take the pills the way your healthcare provider instructed. When people do not take their TB medications as recommended, the infection may become much more difficult to treat. The TB bacteria may become resistant to treatment, and sometimes, the drugs no longer help treat the infection. When there is a concern that a patient may not take all the medication as directed, a healthcare provider may need to watch the person take the prescribed drugs. This is called directly observed therapy. In this case, drugs may be given 2 or 3 times per week, as prescribed by a doctor. You may need to stay at home or be admitted to a hospital for 2 to 4 weeks, to avoid spreading the disease to others until you are no longer contagious. Your doctor or nurse is required by law to report your TB illness to the local health department. Your healthcare team will be sure that you receive the best care for your TB. Tuberculosis is a common disease, yet every individual needs unique treatment and care. We encourage people with tuberculosis and their families to learn, as much as possible, about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about tuberculosis and how to treat tuberculosis, just click on the link at description or visit www.mainmd.com. Thank you.